We are going to discuss the treatment options for valvular heart disease. I am Dr. K.K. Saxena, Senior Consultant Cardiologist from Indraprastha Apollo Hospital, New Delhi. Most common valve disease involves the left-sided valves like mitral and aortic valve. This can cause stenosis or it can cause regurgitation of these valves. When you have got a simple stenosis of the valve, you have got an option to open the valve with the balloons, especially for mitral valves. The valve should be non-calcified. There should be no regurgitation of the valve or no leakage of the valve, and there should be no calcification. The suitability of this option can be assessed by means of echocardiography. In the younger population, especially those who are less than 15 years of age and those who have got severe aortic stenosis, can undergo valve dilatation, balloon dilatation of aortic valve. Similar thing applies for balloon dilatation of pulmonary valve stenosis in the younger age group. In the adult age group, most of these valves starts leaking also, and then ballooning cannot be done. These valves can be repaired surgically or they need to be replaced surgically. Again, you need to assess the symptoms, do the investigations like echocardiography or angiography to find out the best possible mode of treatment. Now, when the valve is replaced, it can be replaced with the mechanical valves, which requires lifelong anticoagulation, or it can be done with a bioprosthetic valve. Of late, for a couple of valve disease, we have got non-surgical replacement of valve, especially for the aortic valve, where the procedure is called transcatheter aortic valve implantation or TAVI, where no surgery is done, but the aortic valve can be replaced. And this is done for those patients who are elderly, who are high risk for surgery, and the procedure is still evolving, but it is available in our center and in this country. Thank you.